here last week, and I did say that if you understand the regulatory framework and how vaccines are moved in international commerce, you understand why the WHO gives emergency use authorization for some countries, because they do not have the regulatory gravitas that Ghana has. I mean, Ghana has one of the more robust regulatory authorities when it comes to medicines in Africa. I mean, you cannot take that away from them. And yes, I can, and I did say on here last week, I can agree with a lot of the things they have written. In fact, if they didn't do that, it would be in breach of quality assurance, because you need to sample every batch of a product that you've registered when it's gotten into your country. The issue with the middleman is not about the FDA not doing their job. It is about that middleman not having a contract with the local holder of the emergency use authorization. That's where the issue is. The issue is not about quality, it is about legality. So if I register a product in Ghana and it's within patent, if you want to bring it into Ghana, I either bring it myself, or I can franchise someone to bring it, or the manufacturer, in this case, if it's Sputnik, the Russian Development Fund can bring it on behalf of somebody. If a third person is bringing it, because regulation doesn't allow you to register the product twice in the same country, then there are regulatory issues and legality issues there. So to end, what I would say is that, yes, the FDA will do all that, but another thing that the FDA would have to ensure is the collation of the adverse events post-immunization, which is the responsibility of the person who holds the emergency use authorization. That is where the real issue would be when a middleman brings it and issues that disclaimer, albeit the disclaimer is issued by all manufacturers. However, when it comes to the adverse effects post-immunization, it is the responsibility of the local procurer of the emergency use authorization. The question I ask consistently is, if we use a middleman, would the Ministry of Health take over that responsibility and any liability that comes with it?
All right.
We don't have answers, and that is where the problem is. So I don't have issues at all with the FDA's regulatory robustness. Now